And a very warm welcome to all of you. Today, I will be talking to you about hair fall. Now, hair fall is an extremely sensitive topic because not only does it cause low self-esteem, anxiety, and social distress, it can also help us in diagnosing many underlying health issues which even the patient may not be aware of, like thyroid, anemia, malnutrition, and also at times many autoimmune diseases. Now, before discussing the abnormal, I'll give a very brief idea of what our normal hair are like. There are about 1 lakh hair follicles on our head, and they grow basically in 3 phases. About 90% are in the anagen or the active growth phase, about 5% in the catagen or the degenerative phase, and another 5% in the telogen or the resting phase. And the hair is shed predominantly in the telogen phase. Now, just to make it very simple for you, if you have a look at this diagram of the hair cycle, as I said, majority of the hair are in the anagen phase. And if you have a look at this hair strand, it looks absolutely healthy, very vital, and it continues to grow in length. About 5% of the hair eventually move into the catagen phase or the degenerative phase, in which you can see that the hair gradually loses contact with its source of nutrition and blood supply. After spending about 1 to 2 weeks in the degenerative phase, the hair will move into the telogen phase. And here, if you can see that the hair is practically dead and is about to be shed off from the body. But even before it is shed, a new hair is already beginning to form. So for every hair which is lost by the body, a new hair will develop in its place, and this will return back to the anagen phase. Now, all of us are losing about 50 to 100 hair per day. And this is part of a normal balance because some hair will fall out and some will grow in. However, when this balance is interrupted, which means when a lot of hair are falling out but less are growing in, this will result in hair loss. And this hair loss is called alopecia. So when should you decide to go and see a dermatologist? When you think you're shedding more than 125 hair per day. So now when would you know that you're shedding more than 125 hair per day? It is basically when you see clumps of hair on your brush, in the shower, in the sink, on your pillow, or if your household help is forever complaining of hair on the floor. You should also meet your dermatologist if your hairline is receding or if your parting is widening or if you notice sudden appearance of bald spots. It should be noted that by the time women actually notice a reduction in their volume, they would have already lost about 25,000 hair. So the best time to seek help would be at the earliest signs of excessive shedding, rather than wait till this situation where your scalp is already visible through your hair, because by then you would have already lost a huge number. Now, this slide is just to motivate you that the results are very optimistic if you seek help in the early stages of your shedding. Now, when you go to a dermatologist, they will do an examination of the scalp to see whether your hair loss is the scarring variety or the non-scarring variety. Simply put, if the follicular openings are no longer visible, it is probably the scarring variety. Now, if you look at this picture of a patient who has a scarring type of hair loss, the skin of the scalp or the affected area appears absolutely smooth and shiny with absolutely no openings of the hair follicles visible. This is the scarring variety, and it is important to make this differentiation right at the beginning of treatment because the scarring variety is permanent with absolutely no chances of regrowth. Such cases would be investigated intensively with possibly a scalp biopsy to find out the diagnosis and to prevent any further progression. The other group of hair loss is what we call non-scarring hair loss, in which there is only a reduction in the volume, but the hair follicle openings are still very much visible. For the purpose of this discussion, I will be discussing only this variety because this constitutes the majority of patients who come to us in our OPDs. Now, amongst the common causes of non-scarring hair loss that we see are telogen effluvium, which is sudden intense hair fall. And this is actually the variety which a lot of us went through post-COVID. Androgenetic alopecia is genetically determined. It is slow onset, very gradually progressive baldness. And alopecia areata, which is patchy hair loss. Now coming to telogen effluvium, which is sudden onset, very dramatic, very alarming kind of hair fall. It is in fact so intense that the patients at times will stop shampooing and even combing their hair for fear of losing them all. Now, this is the classical picture of a patient suffering from telogen effluvium. Every time she runs her fingers through her hair, she would lose balls and balls of them. And this change in volume that you can see has probably occurred over a very few days. It is called telogen effluvium because a large number of hair have entered the telogen phase and they begin to shed. In such cases, history taking is extremely important as this helps us to identify the possible cause which can then be rectified. The patients are asked to recall any possible trigger 3 to 5 months before the onset of hair fall, like COVID, dengue, and typhoid. Now, just to give you an idea of the timeline, post the second wave of COVID in April 21, our OPDs in July and August were flooded with patients suffering from intense hair fall. So just to emphasize that the hair loss usually starts after 3 to 4 months of the possible triggering cause. Now here I've just listed a few causes that we commonly come across. Childbirth is an extremely common cause. Heavy hair fall begins about 3 to 4 months post-pregnancy, and it is normal in a lot of women by the time they're celebrating their child's first birthday. Severe infections, like I mentioned earlier, COVID, dengue, typhoid, malaria are very common causes. Any severe chronic illness involving the liver, kidney, or any chronic anemias. Severe psychological stress is a very, very common factor that we come across these days, in which the loss of a loved one or loss of a job or even a severe exam-related stress can at times trigger off severe hair fall. Major surgeries, of course, are very common causes. Your dermatologist will ask you history of fatigue, changes in your weight, changes in your appetite, as they may suggest thyroid imbalance. And it is important to note that both hypo as well as hyperthyroidism can trigger off hair fall. Another cause that we see very commonly these days, especially amongst teenagers and people in their 20s, are crash diets, which lead to sudden weight loss, which can actually trigger off a very alarming hair fall. Certain medicines like anticoagulants and antidepressants may at times be the frequent causes. Now, in the current scenario where most of us are working indoors with hardly any sun exposure, vitamin D deficiency has actually come up with a very common cause. Now, when you go to a dermatologist and when they do an examination of your scalp, it will show uniform hair thinning. Your dermatologist will perform a pull test in which about 40 to 60 hair are pulled from the base with a very gentle traction. And if more than 4 to 6 are shed off, it indicates excessive abnormal shedding. Certain basic lab tests will be performed for you, like the ones to rule out anemia, iron deficiency, a thyroid imbalance, and vitamin deficiency, and they are rectified accordingly. You'll be given biotin supplements and advise certain hair regrowth serums. Now, as we can see, in majority of cases of telogen effluvium with the correct diagnosis and treatment, the regrowth is very, very satisfactory within 4 to 6 months. Now, coming to the second common subset, which we call androgenetic alopecia, or in simple language, genetically predisposed baldness. In these patients, we often find a family history of baldness. Unlike telogen effluvium, which I said is characterized by very intense shedding, in these patients, the shedding is not too much, and the balding is very slow onset and very gradually progressive. And so these patients often wait months and years before they actually go to a dermatologist. Now, what happens in these patients is that DHT, or dihydrotestosterone, which is basically a male hormone, acts on the hair follicles and makes them much smaller, thinner, and lighter in color. And eventually this hair follicle will totally disappear. Now, if you look at this image, which belongs to a patient suffering from androgenetic alopecia, these are the normal hair strands which have yet not been damaged by the male hormone. And if you can see, they are nice, thick, long, as opposed to these tiny hair strands, which you can see here, which have been affected by the male hormone. They are very small, very thin, and very light, and they do not provide cover to the scalp. When it affects males, we call it male pattern hair loss, in which the first change that we often see is a recession of the hairline. Eventually, the thinning will involve the crown area, as you can see in these images. And in very progressed cases, the baldness may be complete except for a small band of hair which is left behind at the back and the sides of the head. When it affects women, we call it female pattern hair loss, in which the thinning begins along the parting. So you can see there's a whitening of the partition, and eventually the thinning may involve the top of the scalp. However, even in the most progressed cases, women normally retain their hairline. A similar pattern can be seen in patients with polycystic ovarian disease and those nearing menopause. Now, when you go to a dermatologist, although it is a genetic predisposition, they might still perform tests to rule out anemia, iron deficiency, thyroid, and vitamin D, because these factors may be adding on to the intensity of hair fall. Here also, you'll be advised biotin supplements and hair regrowth serums. Now, the only US FDA approved treatment for patients with this kind of baldness is minoxidil. Now, newer hair growth serums containing melatonin are also available, but they have been shown to be effective only in the early stages. The oral medicine available is finasteride, which is recommended in men and postmenopausal women. However, it has its own long list of side effects, and it is always best to discuss the pros and cons before you decide to start it. If your lady patient has an underlying PCOS, we obviously treat it appropriately. Now, when you seek treatment for a genetic pattern of baldness, there are three things which you need to absolutely understand. One, that it is successful only when treated early. So if you visit your dermatologist when you have just noticed excessive shedding, this is the time when tablets and serums are actually going to make a difference. However, when you visit your dermatologist when your baldness is already well established, in such cases, medical treatment will usually fail. The treatment is very slow to act, which means you need to be very patient and very persistent. It can take about 3 to 4 months to control the shedding and as long as about a year to produce any visible changes in the volume. So if you can see these pictures, this is the baseline of a patient suffering from genetic baldness. And as I said, it can take as long as a year to produce visible changes in density. Another patient, this is baseline, and this is at the end of 12 months of treatment. Now, the most important point that I always discuss with my patients is that being a genetic problem, we are not able to change our genes. So whatever new hair growth that you've experienced is only with the support of the medicine. And the day you decide to withdraw the medicine, your shedding is likely to restart. It is very important to understand this to prevent this loop of disappointment when your shedding begins all over again when you stop the treatment. Another therapy which is now commonly being offered for hair loss is PRP, also called platelet-rich plasma therapy, in which the blood is withdrawn, it is processed, and this processed fluid is injected into the bald spots. It is the growth factors present in this liquid which stimulates new hair growth. The results are somewhat better than minoxidil, however, not permanent, so you may need repeated sittings. Now, the treatment your dermatologist chooses for you will depend, of course, on the stage of baldness that you report with. This is the section of a patient with absolutely healthy hair, and this is one with thinning hair, in which you can see that the hair are smaller, lighter, thinner, but at the same time, there are a huge number of revivable hair follicles which are still present. In such cases, minoxidil and finasteride can have very optimistic results. However, if you visit your dermatologist when the situation is like this, when there is not a single revivable hair follicle present, your only option may be a hair transplant. And if done well, it again can have wonderful results. Now coming to the next category, alopecia areata, which is a patchy form of baldness, in which there is a sudden appearance of bald spots. And if you can see that the density of the hair in the surrounding unaffected scalp is absolutely normal. At times, patients miss this themselves, and it is the hairdresser who usually points it out to them. It's an autoimmune disorder, which basically means that your body immunity is a little confused and it is destroying its own hair. Usually, it is a patchy form of hair loss in which the number of patches is few. However, in very severe cases, it can progress to total baldness. You'll be offered treatments in the form of steroid creams, at times steroid injections, and at times even oral steroids and immunosuppressive therapy. However, with a good effective treatment, the results are optimistic and the regrowth is almost complete within a few months. Now, this is the picture of a child suffering from fungal infection. This is a common cause only in the pediatric age group, in which there is a patchy hair loss, but it is also associated with a lot of redness, scaling, and at times even itching. It needs to be treated urgently because it is very contagious, and one child in the family can spread it to everybody else. The treatment is with oral antifungals, and as soon as you're able to take care of this fungal infection, the hair regrowth will be absolutely normal. Now, another category which we very, very commonly come across is trichorexis nodosa, in which this is the general appearance, in which the hair appear very unhealthy, the quality is very poor, and they look very unruly. The shedding is not really from the roots, but the hair tends to break mid-strand. And this is due to excessive heat application in the form of blow dryers, hair straighteners, and curlers. Also use of hair dyes, colors, perming, and all the hair treatment fads that are in fashion right now. It can also happen due to excessive exposure to salt water. On examination, as I said, the hair will look very frizzy, dry, and with split ends. The treatment, of course, begins with now stopping physical and chemical trauma to your hair, and biotin supplements can help you regain the health. Now, seborrheic dermatitis, in normal English, we call it stubborn dandruff, in which there are a lot of scaly patches and red itchy skin. It's very important to treat whenever we're handling hair fall because one, it contributes to hair fall, and secondly, your scalp will not be ready to accept any hair serum. Still, it looks healthier than this. Post-chemotherapy hair fall, another subset that we often come across, and it is possibly one of the most shocking part of treatment in any cancer patient. But fortunately, the recovery is complete within 4 to 6 months. Now, sharing some general tips for healthy hair. The hair should be shampooed twice or thrice a week and should be rinsed very carefully and very thoroughly. Apply a few drops of olive oil after rinsing, as it helps to detangle your hair. Be very gentle with your hair and avoid tugging at your hair, especially when it is wet. A wide tooth comb is ideal for combing wet hair. Blow drying should be done with a hair dryer on the cold setting, and it should be used at least 6 inches away from your head. Harsh treatments, like I mentioned earlier, like hot rollers, curling irons, and straightening are best avoided. Use of pins and clips should be minimal and almost never while you're sleeping. If you do use elastic bands, they should not be very tight. Otherwise, it can cause traction alopecia, which is basically, again, breakage of hair mid-strand. Parting should be changed frequently, again, to prevent weakening or breaking of your hair strands. Now, the most important part, again, which I like to discuss with a lot of my patients with hair fall, is what is a good healthy diet to maintain healthy hair. The 3 nutrients which are recommended are essential fatty acids, proteins, vitamins, and trace elements. Essential fatty acids are present in fish, flax seeds, chia seeds, walnuts, and soybean. But if you're not able to introduce these in your diet on a daily basis, then capsule forms of omega-3 fatty acids are present, and your dermatologist can probably prescribe them for you. Protein intake is absolutely critical. Lean meats, eggs, soy products, and in vegetarians, cottage cheese, beans, peas, etc. are common sources. Vitamins and trace elements are present in meats, fresh fruits, vegetables, whole grains, beans, and lentils. So make sure you introduce all of these in some amount on a daily basis. However, no matter how hard you work, vegetarians usually do not get enough of all of these. So it's an good idea to discuss with a dermatologist, and they can probably prescribe some multivitamin supplements for you. Now, just to summarize what I've talked to you about is that people have about 1 lakh normal hair follicles on their head, and it is absolutely normal to shed about 50 to 100 hairs per day. If you begin to notice excessive shedding, meet your dermatologist immediately and do not wait till the time your scalp begins to show. When you go to a dermatologist, they take a history to find out the possible triggering cause. And the most often that we come across these days are stress, a genetic pattern, and of course, a poor diet. Now, while making a diagnosis, your dermatologist might want to know your family's history, because as I said, in genetic patterns of baldness, we do find a family history. Your hair may be examined under a microscope, which is called a trichoscope. Some basic blood tests like the ones for anemia, vitamin D, and iron will be performed. A scalp biopsy may be done, but not in too many cases, especially in the ones with a scarring pattern of hair loss. Now, depending upon your cause and your diagnosis, your dermatologist will offer you tablets, serums, creams, and as I discussed earlier, the results in a lot of cases is very optimistic. Hair transplant is needed in less than 5% of cases. Now, with this, we come to an end of this discussion. I hope I've been able to clarify at least some doubts that you may have had. For any other queries, you're most welcome. I'll be happy to answer. Okay, so I have a question from Mr. Nitin, who says that he has alopecia areata on his beard. For alopecia areata, there is really no home-based treatment, so I would strongly recommend go and visit a dermatologist. And depending on whatever situation is, the drug of choice, at least in the beard area, is injectable steroids, because beard is a very cosmetically important area and we do not wait long and wait and watch for a regrowth. So injectable steroid is what is the treatment of choice. However, your dermatologist might choose to start with steroid creams and other non-steroidal options, but you do need to visit a dermatologist for any further treatment. Okay, so Ankita has a query about whether or not we should be oiling our hair. Now, Noida water, and I don't know from all places that you're connecting, hard water is a major issue in a lot of cities. Hard water tends to absolutely dehydrate our hair. So it's not a bad idea to oil our hair at least 2 to 3 hours before washing. Now, oil is something which is an absolute no-no only in situations where you've suffered from chronic dandruff. If chronic dandruff is not a problem, then oiling is always a healthy option for you, and you should be oiling your hair. Okay, so Ria has a problem with dry, rough, and thin hair after her wedding. I don't know, Ria, if certain hair treatments that you have been doing, they might have triggered off the problem. So in such cases, either meet a dermatologist, or at best, at least what you can do is maybe take a course of biotin for about 3 months. At the same time, if you do meet a dermatologist, they might rule out other causes which are common in your age group, like an iron deficiency. As soon as you correct your internal deficiencies, you do notice your healthy hair coming back. Okay, so Rahul has mentioned a certain new treatment that is here. It is not as yet in our guidelines. In alopecia areata is if what you're talking about, then it has a very set protocol of using steroid creams and other non-steroidal medication. No, hair fall, of course, is one, but as I said, your quality of hair becoming poor in itself at times may be indicating, for example, in patients with severe anemia, they may not be really shedding too much, but the quality of hair will suddenly become poor and they'll become very fragile and break off easily. Okay, so Sarath says that his hair is too oily and some amount of dandruff is what he is noticing. Okay, so see, whenever you have oily hair, I explain it very easily to my patients, is that all of us are shedding off a lot of dead cells. Now, when your hair is too oily, the oil secretions are acting like a glue, and all of the dead cells which should have shed off are basically accumulating layer upon layer upon layer, which is what is becoming visible to you as dandruff. So in such cases, the first step is possibly a daily cleansing of your hair with a shampoo. And other than that, I really do not know what all you have been advised. If it is just shampoos that you have been advised, because at times if only anti-dandruff shampoos are not working, then we do give some oral antifungals, and at times it may not be simple dandruff, at times it may be the beginning of a scalp psoriasis. So without an examination, I may not be able to answer this question completely. But I'm sure if you revisit a dermatologist, they would be able to find some solution for you. Okay, so Vijay, I'm you discussing something about premature graying. Now, the results of the treatment are very age dependent, and in premature graying, which begins in the teens or early 20s, we do see some results with certain serums and tablets that are available to us. There is a certain serum, I'll not be taking any brand names over here, but which has melatonin in it, and it is known to give some patients some amount of relief. Then there are tablets containing phenylalanine, which is again a repigmenting medicine. But again, as I said, best to be to your dermatologist. However, again, as I said, if you're already in your late 20s, there is really nothing much we can do to reverse this problem. Okay, Sandeep, now if you say that your hair is becoming very thin, I understand it is possibly a genetic form of baldness. Minoxidil is something which is what we normally advise. It is available over the counter also. So if you wish, you can always begin with that. Any further management, of course, under the supervision of a dermatologist. And that's the best way to go, I think. Okay, Ria. So again, we have a lot of pharmaceutical companies making very good quality biotin. Again, wrong to be taking any brand names here. But gummies, I would not really advise, because most of these gummies which are being advertised on social media have not been made by any respectable or reputable pharmaceutical companies. Because if any pharmaceutical company launches a medicine, it has already undergone a rigorous amount of quality control and have a lot of certificates attached to them. So if at all you want to take a biotin supplement, please take a prescription medicine rather than rely on gummies. Okay, so Mr. Ravi has oily skin and has noticed some gradual hair fall for about 4 to 5 years, and scalp visible in the crown area. Okay, now it sounds again like what we call a genetic pattern of baldness. Now, coconut oil, as far as I understand, is basically more like a conditioner used to soften out a hair. It would not do anything in terms of growing your hair back. So again, you would need some form of medical treatment. And since you've already waited 4 or 5 years, I recommend it is high time now that you visit a dermatologist, because the longer you wait, even the dermatologist may not have any solutions. No, again, Mr. Rahul, as I said, the only US FDA approved molecule is minoxidil. Other than that, we are using a lot of procapil and melatonin. The efficacy we find is almost always less than minoxidil. And when we talk of cosmetic actives, again, very difficult for me to comment, because there is absolutely no mention as to what exact ingredients that they have used, what is the percentage of the actives that you're using. So I feel if at all you're serious about working on your hair, always better to use pharmaceutical medicines which are prescribed by a doctor. Yes, excessive dandruff can add on to hair fall. So like I mentioned during my lecture, even before we start treating a patient for hair fall, our focus is to first give them a healthy dandruff-free scalp. So yes, it makes sense to visit a dermatologist, let them first handle the dandruff. In the meanwhile, they'll of course investigate, and I'm sure it'll figure out for you. Ankita, yes, hair masks, again, they act more like conditioners and softening agents. So I don't see any harm in using them. But again, we are only, with them, we are only making sure that your hair appear a little softer and silkier. They would not really do anything about your hair loss or loss of volume, but I think they are safe enough. Okay, Niharika, your damage during swimming is because of a lot of excessive exposure to water, which is high in salts and chlorine. So maybe oiling your hair with coconut oil liberally before you go in for a swim helps, and also take a shower immediately after you get out of the pool. Okay, Chandan. So again, when we talk of organic shampoos, if the source is reliable, if you really know that a shampoo which has been labeled organic is actually organic, then of course it is far better. Okay, so Mr. Sandeep, how much percentage of minoxidil? Okay, so minoxidil is available in the market as 2%, 5%, and 10%. But 5% is what we see optimal results with. So I think 5% is what is advisable. Okay, so you've had a small surgery in which your hair are not growing back. Now, whenever a surgery has been done and something, possibly a lump or whatever has been removed, now in those cases, this is again a category which fits into what we call a scarring pattern of hair loss, and very unlikely that hair are ever going to regrow no matter what you do about it. Okay, so Neetu, which oil should we use and how often? Again, Neetu, we do not need any specific high-end brands of oils. Any regular vegetable oil that you're comfortable with, which may be coconut oil, your edible olive oil, mustard oil, almond oil, anything. So you really don't need to spend too much of on any oils. Any regular oils that are already there in your kitchen are good enough for us. Yes, Rahul, to some extent, yes, chronic dandruff, to some extent, yes, contributes to hair loss. So since I don't see any more questions, I think possibly that's the end of the list of questions for us. It was lovely interacting with all of you. Thank you so much for your patience.